Just a quick introduction. My name is Lena DeTar. I am the first-year shelter medicine resident here at Oregon Humane. I was previously employed at the Arizona Humane Society and the Humane Society of Utah. I graduated from University of Minnesota in 2009. This presentation is about managing ringworm in a coalition shelter, just sort of trying to get things from where they are right now here to where they could be, and also going forward, doing some studies, things like that. So it's more of a presentation of possibilities as opposed to a presentation of here's what to do. So what is a coalition shelter is the first kind of wrinkle in the little ringworm story here. We have an organization here called the Animal Shelter Alliance of Portland. It is a group of about half a dozen rescues and animal controls and humane societies in our metro area that work together to try to decrease euthanasia of dogs and cats and other animals. What we do to do that is to transfer pets with more challenging Asilomar codes from one shelter to another shelter that can take care of them. And Oregon Humane is a piece of that puzzle. We accept medical transfers from the other shelters in our area, and that includes ringworm. So here's our building and our logo here. Why is ringworm so tricky? Well, can you tell from these pictures which cat has ringworm and which cat doesn't? It's a tricky question. Dr. Newberry and Dr. Moriello showed that, at least in Wisconsin, 82% of cats that had skin lesions were culture negative, and 14% of ringworm positive cats had skin lesions. So the answer is, I don't know. Cats that are woods lamp positive, we can be pretty sure that those guys do have ringworm. And then the gold standard, of course, is cats that are culture positive. But the problem with cats that are culture positive is that some of those cats are just carrying spores on their fur, like a dust mop, and they don't actually have the infection. So another reason that ringworm is so tricky is because of the treatment of ringworm. It is a long course for the shelter. The reported times in Dr. Newberry's studies for Sporanox is about 3 to 4 weeks of treatment, and that doesn't count the time for culturing. And then terbinafine is about the same, 3 to 4 weeks for that one. Enilconazole is shown to have good activity against ringworm, but it's not available in the United States. And we don't have any other medications currently validated in shelter situations, though I know that other people are working on studies currently. Verifying that the cat is actually cured can take just as long as the treatment. If you are requiring 2 negative cultures and you're reading those cultures out for 14 days for microsporum or for 21 days for trichophyton, you would be keeping that cat in quarantine for that long after they'd already been cured. The GS is for gold standard, in case you hadn't figured that one out yet. And medication can be very expensive if you're interested in using Sporanox, because the generic is considered not to have the same efficacy as the name brand. As you can see, this is from our distributor, MWI. These are the prices that they have. And 10 milligrams per mil for the Sporanox liquid is very, very dilute concentration, so you use that bottle up very quickly. Breathing for the staff takes a long time, so you have to invest the money in paying enough people to take the time to do lime sulfur dips, which smell horrible for the cats and for the staff, so it's not something that they like to do. Excel shampoo may provide a better solution for us with that one. I know that there are some studies currently in the works from Dr. Newberry. And then time-intensive husbandry. So you can't spot clean with these guys. You do have to do daily cleaning and laundry, and then everybody needs their daily medication, and so that takes a lot of time from the staff, which costs money for the organization. And then they have to have a good quarantine facility with the proper PPE provided every time, which again is another financial burden. And then, of course, there's the long length of stay for the cats that are in the ringworm quarantine room. Yet another reason ringworm is tricky is because it is resistant to most disinfectants. So quaternary ammonium won't kill it. Trifectin or Virkon won't kill it. Bleach does, but it has to be 10%, and you have to have at least 10 minutes of contact time in order for that to work, and there can't be any organic material in the area, otherwise the bleach is inactivated and the spore remains alive. Accelerated hydrogen peroxide products may provide us a solution for that. They're about the same price from what I hear as trifecta and Burcon. They have a really good efficacy compared to bleach in the presence of organics, not perfect. And there's only a 3 to 5 minute contact time, so that might be more efficient for the staff when they're cleaning. It does cost more than bleach, and we don't have the studies yet for that product. And then, you know, in addition to ringworm in general just being tricky, we find it challenging to treat ringworm here. We have a beautiful 12-cat condo isolation room and really conscientious staff. We can house about 15 to 20 cats in our quarantine room at any given time, and that's because we double up the litters. We don't like to split up the young cats. The reported times to cure, those 3 to 4 weeks, are not what we have been seeing. So we have cats that remain wood lamp positive for about 5 to 9 weeks, and they remain culture positive for 3 to 4 weeks after that. I recently cultured our floor, the step stool, and the broom in the quarantine room, and they are all growing Microsporum canis like crazy. The counter, on the other hand, is negative, so that's nice. I feel safe putting my papers down on the counter.
We're happy for your counter.
Yes, me too. The average length of stay in ringworm quarantine for us over the last couple months since I started tracking this is 80 days,
Ouch.
which has a range of about 45 days to 135 days. And that's really, really long, and we feel really bad for those cats, and we're trying to figure out what better to do. This is what we're currently doing here. So we somehow managed to identify that there is a lesion, or somehow accidentally noticed that the cat is wood lamp positive, or maybe there's a history suggestive of ringworm on transfer. We don't have any population screening at the moment. So then we remove the cat to quarantine. We start medication. We've been using fluconazole at 5 to 10 milligrams per kilogram for the adult cats, and then for any cat that's under 2.5 kilograms, they get itraconazole at 10 megs per kilogram once daily. We have been using a generic 80 mg per mil compounded suspension because it's a lot less expensive. We do start bathing right away. Per the bottle instructions, we had been using 4 ounces per gallon twice a week, bathing them by dipping them into the sink and then using a cloth to get their ears and their face. And then weekly cultures once they became wood lamp negative. This is it's not exactly what our ringworm room looks like, but it's very similar cages to these. The nice big open spaces there, and then the little sort of litter box area with the plastic dividers that you can slide in and out for keeping.
This is Sandra. I wanted to just ask you kind of what your preference is. Do you want to just go through the whole presentation and then have commentary and discussion after?
We can certainly do that. I do have some changes to this protocol proposed, so coming up. So
yeah, that's why I'm just sort of asking what your I'm perfectly capable of waiting till the end.
Yeah, why don't
and so that's what seems fine, but I didn't know if you kind of want to talk about things as you go.
Why don't we wait to the end, and if you don't?
Yeah, that sounds perfect. Okay, I just wanted to check.
But if you feel like you're going to forget what you were going to say, stop me.
Okay, I won't.
Okay. All right. So this is our cleaning protocol. The cages are cleaned with some percent of bleach daily. It comes out of a automatic mixer on the wall, and not everybody knows how to change the concentration, and so they just fill it up with whatever the concentration was when they got there. So the ringworm laundry, we add the bleach to the laundry, and we run it at sanitized temperature, and so as long as it's over 110 degrees, that should take care of all the spores without any trouble. And then we mop the floor. What I found out recently that we only do it once weekly. And I thought we were doing it every day, but it turns out that the cattery staff is worried about the fumes and the cats. It gets really bleachy in there if they do it every day. And I also recently found out that some of the techs were letting the cats out to play on the floor because they felt so bad that they were cooped up in their cages all the time. So that's probably where my floor culture came from. And here's the Family Dollar bleach that kills viruses that cause cold and flu and ringworm too. So with all these things, it just really sounds like the worst disease ever. And that's kind of true, but at the same time, the cats aren't really suffering at all. They, maybe have a little itchiness. They have a little bit of kind of just irritation on their skin, but the lesions are quite mild. They don't really care that they have ringworm. They would be happy to just carry about on their business. And the human lesions are also mild. They're probably even more mild than the cats, depending on the person. They're often treated with inexpensive over-the-counter medications, and a lot of people that come in to talk to us say, oh, yeah, I've already had ringworm, I don't really care. It does, of course, preferentially affect kids, and so people get upset about that one. And, of course, people who have some sort of immunocompromising condition. The cats, and actually it's mostly the kittens, are not the only environmental source of ringworm, and you can certainly get ringworm from the mats if you wrestle, or from other people, or from wildlife, or you can get not necessarily what we would call ringworm, but a fungal skin infection from a saprophyte if you like to garden or play with potatoes. And still, it's a leading cause of feline euthanasia in shelters across the country, even though the cats don't really care. And this is why. This is a Brookhaven Animal Shelter, which I tried to Google, and I think it's in Long Island. They had a ringworm outbreak. They were closed from August 28th until October 8th of this year. And this is the other reason why, because the cats get it and they give it to people. And I just wanted to highlight one of the things that they said in this article, as though it wasn't such a big deal. This outbreak led to 4 dogs and 25 cats being euthanized as a result of the outbreak. And they're all happy because they got to open the shelter again. So this disease is where public health and public relations really collide, because the ringworm that the cats give to the people may not be that bad, but the public relations effects on the shelter could be really, really bad. And this is Dr. O'Quinn in her chapter on outbreak management in our shelter medicine for veterinarians and staff, the recent edition. She writes that although it's rare, there are times when an entire facility should be quarantined with no animals entering or leaving. This might be recommended during a widespread outbreak affecting large areas of the shelter to facilitate cleaning and allow more control of risk factors. And she specifically says ringworm and canine distemper virus have caused several outbreaks that resulted in voluntary shelter closure, indicated when the disease is known to be severe and highly contagious, or when the disease presents a significant zoonotic risk. And so it is actually a big deal. It may not be the worst disease ever if you have it, but it is a big deal. So the community mandate that we have with the ASAP is that we are not going to euthanize any cats that have the Asilomar code of H or TR, and the ringworm is considered TR. So what we need to do here in Portland is to keep figuring out the best way to screen, treat, and cure ringworm so that we don't have an outbreak and so we don't have to euthanize any cats. And Oregon Humane Society is a focus for transferring ringworm cats and always has a population of ringworm cats as a result, and therefore can be a great opportunity for us to get the protocol right and to potentially do some studies on ringworm and epidemiology and how the community that has given us this mandate feels about this particular disease. And this is just for ASAP. They reduced euthanasia by 65% and now save 85% of cats and dogs in this metro area, which is great. So there's a lot of different questions that I can come up with for, studying with ringworm, and maybe questions that you guys have some answers for. So this is a good time for you guys to just kind of shout some things out if you know. Currently, we aren't doing any screening for ringworm. Other than visual lesions, but we know from Dr. Newberry and Moriello's studies that may not be the best sensitivity and specificity. But we also haven't seen any transmission, so I guess that's okay.
I'm sorry, can you just say what you haven't seen? You said you also haven't seen what?
Transmission of ringworm in the shelter from one animal that we didn't know that had it to another.
How do you know that if you're not screening?
Well, that's a good question.
Well, on intake, we're not screening.
Yeah, we're not screening.
We're not identifying it in the shelter or hearing about it after. That's what you're saying, right?
We don't have any information from adopters telling us that they have adopted a cat that we didn't already know had ringworm, that now has it. And we haven't identified any cats that seem to have acquired it from a source here in the shelter. So that's all I know. Again, we don't know because we don't screen. At what ringworm prevalence, I'm talking about different species here, so we see pretty much 100% Microsporum canis. And I look at all the plates, so I know what the spores are looking like. If we have that type of a distribution, would screening with Woods lamp make more sense than trying to culture every cat if we were doing some sort of a screening program?
Yes.
And I said here that over 90% of the cats that we see that have been diagnosed with ringworm are Woods lamp positive. It's probably closer to like 98% here.
And that would be really in line with what we see and what our current recommendations are.
Excellent, because all the textbooks say, 50%, which I don't know where they got that from. And then what about just screening kittens? Because kittens are responsible for the worst shedding. It seem to be little ringworm bombs when they go off in the house. And so would screening the kittens be enough? Because, it takes a long time to screen cats, even if you don't have to wait for the Woods lamp to warm up, which obviously you don't. So, and then, how much does regionality play in this type of thing? Are there regional strains that would respond better to certain treatments versus others? So those are my questions about diagnosis.
Do you want to talk about those now or come back to those? Sorry, I just wasn't clear what you were saying.
We can certainly talk about those now. Do you want me to go back? What do you guys think? Should we just screen kittens?
So I'm not really, I wouldn't recommend just screening kittens. Our current recommendation would be to screen everyone, but when I say screening, I mean looking them over and using a Woods lamp.
Okay.
And then anybody who's not Woods lamp positive, who has an inflammatory skin lesion, those I would recommend doing a culture on. And as you said, and as it sounds like you've recognized yourself, that leaves you with a very few number of cats who are sort of in that lesional, but you still think it might be lesional, Woods lamp negative, and you still think it might be ringworm. Is usually a very small number.
Excellent. I'm glad that you guys are seeing what we're seeing.
And no, we have not seen regional strains that respond better to different treatments, but let's come back and talk about treatment, because that was the thing that I have some questions about your treatment protocols. That's the thing I think is probably getting in your way.
Okay, excellent. So let me get through treatment questions and then my proposal for the new treatment, and then tell me what I'm doing wrong.
And again, could be that there's regional strains. We definitely know there are some strains that seem to be sort of hotter, that cause more disease and more lesions quicker than others. But I've seen that variation in like, oh, that's a bad one, and no, that one's not so bad in every region that I've worked with. So again, like we don't have all that information, but it doesn't seem like that's true.
Okay, excellent. Okay, so here's my questions about treatment. So, does fluconazole work as well as Sporanox or terbinafine? Because there isn't any information out there. Everybody that I read on VIN, which I know is anecdotal, sort of clinical experience type information, before about 2009 was saying don't use it for ringworm. And then after about 2009, 2010, they were like, well, it probably works. We just don't know that it works as well as itraconazole.
We don't have the studies. We don't have the studies to tell us the absolute answer to that question yet. We're actually just in the process of trying to gear up to do some more field studies at our treatment center in Wisconsin. What I have always been told is that it's likely fluconazole doesn't work as well because it doesn't tend to concentrate in the skin as well as itraconazole does. We did a very recent study with terbinafine. It was in a really, really difficult situation that would have been hard to sort of bring about cure in any case. And originally when we started using it, we did have to take a number of cats to rescue with itraconazole. So our rule is, just so you know, again, when we talk about treatment, our rule when we're doing research is if the cat's not cured by 6 weeks, then we switch back to what is for us our baseline, which is itraconazole and lime sulfur. And so when we were originally using the terbinafine, we had what we would call some treatment failures, and we weren't happy with that, and we would switch to itra and lime sulfur, and they would clear right away.
Okay, good. Yeah, because I read the paper where you were comparing 14 days to 21 days on the terbinafine, and that seemed like a big difference there as well. Yeah, and so, that paper is written, and I have to say that I still love itraconazole and lime sulfur the best. I feel like we'll talk about why I think you might be seeing what you're seeing, but when it's used the way we use it in Wisconsin with those treatment protocols, I don't see it fail. I don't see it do unexpected things. It's very reliable, and it works the way it's supposed to work, and I don't know of anything else really like that. Like, I wish doxycycline would do that. So, are you talking about the terbinafine with that, or the sporonol? No, I'm talking about the itraconazole and lime sulfur. So, if I had my preference, I would always use itraconazole and lime sulfur at this point. That's my first preference. What we saw in the study that we did in this other shelter was that it looked like in the end the terbinafine worked just as well. That shelter it was a very, very complex setting, and so I want to repeat it in the shelter that where there's not so many weird variables going on, and see if it's equally as good. And that's, again, something we're gearing up to. I'm not quite sure when it'll get done. Excellent. Well, I can't wait for the results on that one. Yeah. But anyway, that's, and I'm not aware, we haven't done anything with the fluconazole, but I have heard from various people that the expectation is that it wouldn't work quite as well. Okay. And then the next question here is, could you use both terbinafine and an azole at the same time for a faster effect? Because they do use different mechanisms for metabolism. Fluconazole is eliminated in the kidneys and terbinafine in the liver, and the fluconazole is P450, but terbinafine is not. And so I don't know if you know of any safety studies to say that would be okay. I don't know of any safety studies to say that would be okay. And again, for me, using the treatment protocols that we've used in general, you bring about cure very quickly and safely. And so for me, I don't mess around with it too much because I'm happy with those times. The time that we published, the days to cure that we published in our first paper with itra and lime sulfur was actually about 18 days was the time to cure. And then there was some time for recognizing the cure after that. But those cats were all what we would call P3. So those were severely affected cats because we threw all the other cats out of that calculation. So 18 days for severely affected cats. I wish it was even faster, but that's to have, a completely negative culture. Well, compared to 80, I think that's fine. But and I can tell you, let's ask the rest of your questions, and then I can come back to what I think is going wrong for you guys. Well, right. Okay, so the next question I had was, is 3 weeks of treatment enough? So if you have a cat that doesn't cure in 3 weeks, what we've been doing is continuing the medication. continuing medication.
Yeah.
And
so let me interrupt for just a minute because I'm like trying to behave and sit on my hands. I think the real problem is you're not using your lime sulfur at a strong enough concentration.
Okay, good.
So when we started our study, 10 years ago, we started with 4 ounces to the gallon of lime sulfur, and everything else was the same, and we were absolutely miserable.
Okay.
Absolutely miserable. Hated what was happening. There were terrible times to cure. I was regretting that I had ever agreed to try this. The volunteers were miserable. None of the cats were getting better. We changed to 8 ounces per gallon, and the sun came out, and there was a rainbow, and everybody was happy, and the cats all got better.
Excellent, because that's in my plans later.
Okay, so that's what I think is the primary problem. The other problem that I see in your protocols, and I don't know what to tell you about it because, in fact, Dane County just switched over to some kind of compounded itraconazole, so we'll see what happens in that shelter because apparently itra's been really hard for them to get. But every time I have a shelter who calls me who's frustrated because the protocols aren't working the way that we describe them, and they're using a compounded itraconazole, when we have them switch and have them stop using a compounded itraconazole and go to using brand name Sporanox, the problem goes away.
And I think that's one of our goals, but we are having a very hard time finding it.
Yeah, and so what I would probably do if I were you, what I would recommend for you guys if you can't get the itra is to go to 8 ounces per gallon and use the terbinafine.
And that's actually what I have coming up.
Well, good for you.
Okay, so here's another question. To shave or not to shave, does that really impact treatment times?
It doesn't, and we are really big fans of not shaving unless you have a really long-haired cat. Like you were talking about a Persian cat. Mm-hmm. With Persians, we would recommend clipping but not shaving. And again, I've seen it happen. You have to be so careful with clippers. You can really give cats the most horrific thermal burns, and you won't see them for about 2 weeks until after the cat is clipped. And then it's like they come up from under the skin, and their skin will slough off. It's horrible. And so for us in a volunteer program, the idea of clipping was just, we started, Karen Moriello felt really, really strongly about clipping. She had always clipped. And one kitty got a thermal burn, and I said, no more clipping. Let's just try it and see what happens. And so nobody got clipped. And so all our data is without clipping.
Excellent. Okay, so I might shave just that lesion that the Persian has on the side of her body, but not the rest of it.
Yeah, just the Persian. And the reason to clip the Persian is not because it brings about cure faster. It's because with all that long hair, when you're doing the dip correctly, she's just going to end up all matted because she's not going to clean herself really well, and she's going to be getting wet twice a week, and she's just going to get all icky. I don't think it actually makes her cure faster. So, I would maybe give her a little lion cut or something.
That sounds great. And then, so dipping, right? Would doing it every day lead to faster?
Would it lead to faster cure or staph revolt? Is that the question?
The answer to that.
So we did a little, it wasn't a study, but we did a little project where some cats came into the veterinary school at UW, and it turned out they were infected with ringworm, and so we dipped them every day and cultured them every day, and it definitely knocked down environmental contamination very substantially, and it takes several days for them to go back to being culture positive again once you stop. And so, again, it could be worth studying to see if you dip cats every day, would they cure faster? I don't really think that it would because, again, the way I usually describe this is that you're kind of making a sandwich, that you've got the spores that are on the hair coat and the skin, and then the spores that are the fungus that's growing in the hair follicle. Mm-hmm. And you need the oral meds to kill the fungus that's growing in the hair follicle. The lime sulfur doesn't touch that. So the lime sulfur is like the outside bread of the sandwich, and then you need something to come from the inside too. So dipping every day would mean you would never be, shedding spores into the environment. But with our studies, what we've seen is that if you dip twice a week, you also don't really have any spores, not very many anyway, shedding into the environment, and we don't feel like we're tormenting the cats as much.
Or the staff.
Or the staff. I mean, it's not, it's not like great fun, and it takes a really long time. So what we try to do is sort of balance the economy of, how often do you do it? Once a week was definitely not enough. We tried that. But twice a week for us seemed like kind of the perfect bargain.
Okay, excellent. And then kittens seem to be a problem for us. They seem to be taking longer to cure than older cats, and it seems like the smaller the kitten is when they come in with ringworm, the longer they have it. And
that's another really great realization, and that's one that I posed to Karen, I think about like 7 or 8 years ago. And it's important because for what we were seeing at the shelter was like these little unthrifty, bony kittens, coming in covered from head to toe. So the first thing I would say is look and see if you guys do any kind of scoring. At the time that I realized it is when I was doing scoring of the lesions of all the cats, so I really knew like who was severely affected and who was mildly affected. And one thing we found was mildly affected animals got better much quicker. Big surprise, right? So that we knew. So it may be that what you're seeing primarily is that your adult cats are more mildly affected than your kittens. And so that may be one reason they're getting better. The other reason, and I don't have like a study or anything other than the pharmacokinetics to point to for this one, but that those skinny little kittens have no body fat.
Nope.
And the medication concentrates in their fat, and it's better absorbed with their fat, and they have no body fat. And so this, at least, is kind of my theory, and Karen agreed with me that may be part of what's going on. So all the medications are better absorbed with a fatty meal. Okay. So feed those baby kittens fatty meal.
And they get really fat in our ringworm quarantine.
Yeah, I mean, that's, so maybe by the time they're fat, then they should be cured. But that's so those are the only two things. I mean, do you have any other reason that you think that it's happening?
Well, I was just thinking about the development of the immune system and how that was maybe preventing them from sort of self-cure as sort of any sort of immune response to the ringworm at the same time as the medications were working.
Yeah, I mean, it could be, I think, it depends on how little the kittens are that you're talking about. Most of them are probably fully immune competent. But I think the other, again, like they come in usually more severely affected. Adult cats, again, I haven't tried this in a research setting. I'm only kind of repeating what Karen has told me, is that adult cats in a research setting, it's not easy to infect an adult cat with ringworm. You have to keep them from grooming everything off of them. And kittens, if they don't have somebody taking care of them, then it's not that hard to infect them with ringworm. So at least for what I've seen, the animals who come in, with this, like, I'm covered from head to toe, and you can see my Woods positive from across the room.
Yep.
Those are usually the kittens. And so that's, they take longer to cure because they're so severely infected, I think, usually. Whereas the adults, they might have, like, small lesion, but they're not usually covered from head to toe.
Yeah. So this one, I know that you're currently working on a project with Excel. Is it Excel shampoo that you're working with right now?
Yep, it is. Yep. And we just, I don't know if Becky's on the phone or not, but we just started trying it out on a few cats. We did the studies in the lab, and it looks like, oh, hey, that might work. We did think that same thing with the malaseb concentrate, though, and then when we went to do the study, it really didn't work the way we wanted it to. And so we don't know yet, but this one at least, like, we've geared up and, like, we're ready. We're going to try it out on some animals now and see what we think. We're picking animals coming into the Ringworm Treatment Center in Wisconsin, and if it looks like, just sort of anecdotally, it's working on the first few that we pick, then we're going to try to do it as a randomized trial compared to lime sulfur.
I'll tell you, we're going to start using it too, but not as like a primary thing. So.
Okay.
And this is just to kind of how this cat feels about the lime dip.
Yeah, one of the things that we're seeing that we're trying to figure out with the shampoo is, so again, it's actually in our hands in Wisconsin. I would say the lime dip is so far seeming even a little bit easier than the shampoo. Because part of the deal with the shampoo is you have to leave it on for a certain period of time.
Right.
And I know this picture is a joke, but I don't know how you're applying the lime sulfur, but that really has, again, like that has a huge amount to do with how difficult it is and how successful your treatment is.
It actually talks about getting a rose sprayer. That's on the list.
Yeah, and so like using it, dunking the cats in it, it's not. I have not seen that be particularly successful, and the cats really hate it, and the staff really hate it. But if you use the sprayer, it's much more well tolerated and much more successful.
Excellent. Okay, so here's just a monitoring question, one that I have been trying to answer on my own. Is culturing indicated if you can see glowing hairs? I know that you'd want to culture when you first had a diagnosis to see what species or, what the P-score was, what the cat that you were dealing with. But if, you come back the second week and their nose still glows, do you need to culture that cat, or can you just come back the next week and say, oh, the nose has stopped glowing, now I'm going to culture it?
So we recommend culturing every week, partly because then you can recognize cure faster. If the nose is still glowing like it was the week before, and again, this just comes from all the scoring and stuff that I was doing during our field studies, but that what I found was that if the nose was still glowing, and we're talking about the hairs on the nose, just to clarify for everybody who's listening, because the skin is not the thing that glows, just the hairs should glow. And if it's still glowing like it was before you started treatment, then the odds are that they're missing that when they're treating. And so that was actually, I used to use it almost like Glow Germ with the dippers that we had, where I would invite them to come with me when I went through to screen all the cats, so they could see the areas that they weren't treating appropriately with the topical solution. And it turned out that, they were trying to be nice. And so it tended to be the areas around the eyes, on the nose, and inside the ears that were often Woods positive persistently. And it turned out that once I started having them come with me and they could see that that was going to mean that cat was going to stay in the treatment area for longer and have problems getting better, they started being much more aggressive about going into the face with a raglet and really getting that treatment in the areas that they needed to, and then miraculously they were no longer Woods positive, and then they would cure.
Okay, excellent.
With the malaseb, when we were doing that study, one of the things that made me really hate malaseb is that I'd have cats who were coming along and they were all Woods negative, and then I'd come in one day and they'd have like new Woods positive hair sprouting in various places, and that became the place where we would go to rescue because we could just see that it wasn't effective. So persistent Woods positivity for me is an indication of a treatment problem, at least, and a treatment failure potentially in the making.
Okay. So this would be more work for the vets, but if you cultured every 3 days, could you cut down on length of stay? So if you had, cure in 18 days, you'd still have to wait, 14 plus, 21, 14 days to have 2 negative plates at 7 days. You'd have to wait 17 days to have 2 negative plates at 10 days.
Yeah, I totally get your point. The issue with it is, could be, and the issue with it is, and again, like you don't have a board-certified dermatologist that you're working with, so it's easier for you to do whatever you want. For Karen and I, she still very much lives in the world of dermatologists, and so it's always hard for me to remember that, but she reminds me at intervals that, the gold standard when we started this was 3 negative cultures, each held for 3 weeks, and each taken at a 1-week interval. And when we came out and said, oh, wait a minute, you only need 2 negative cultures, and one of them, the second one you can hold for only 14 days, that was like major league upheaval in the dermatology world, right? Because that was like us coming out, sort of the equivalent of us coming out and saying like, oh, you don't need to vaccinate on intake.
Yeah.
And so that's what we worked with because we were able to identify that point in our research data, and we felt like we had the support to be able to say it because we never saw a cat look back after that point. Could you identify it sooner? Yes, maybe you could. The problem with culturing more frequently has to do with the intervals for dipping. So could you dip? What we do now is we always culture before we dip.
Okay.
And so if you wanted to do that, you could, if you're going to dip every 3 days, you could always culture before you dipped.
Uh-huh.
But what you'd want to do, again, theoretically, if you have to answer to the dermatologist, that what you'd want to do would be to do that long enough that you'd have the research data to show that when you stopped, that your culture data was real. Right. And that it wasn't just because you were doing it, and you had just dipped a few days prior. Yeah.
And then this last question is kind of a theoretical thing, and I'm not really sure what's available yet. But
wait, can I say one more thing before we go into the other thing? Is that the other thing about trying to cut down length of stay is, I think, if you used really effective treatments in really effective ways, that would probably do more to cut down your length of stay than culture and be a better cost benefit.
Right.
Than culturing every 3 days.
Okay. Thank you.
Yep.
So, and then this is kind of where my sort of study interest comes in. So, ringworm cats, as you mentioned in your paper, are often the most adoptable population. So they're kittens, they're long-haired cats, they're fancy breeds. A lot of times, because we work so much with them and we do so much that's mean to them, they end up very well socialized. And so my question is that could we ask if the community to share the burden of ringworm treatment? So, we would get the cats started on their way, and then we could provide medication to the new owner and lots of client education, like we do with diabetes or with chronic skin infections or other treatable, rehabilitable, or treatable, manageable diseases.
So I think it's a really great question, and just to put it in perspective, I joke all the time, and so this isn't a secret that I'm saying this, is that the community that I live in is as close to being able, you could describe this community as kind of hyper-vigilant. And so where they came from, ringworm was like this scourge, and they thought of it as like, they were really, truly like they adopted out a kitten who had ringworm, and the girl invited her whole brownie troop over to meet the kitten, and then all these kids got it, and all the other animals in the house got it, and it was a big deal. And so to switch to a policy where they were treating the animals was a huge shift in the first place. And Karen and I have been joking a lot, especially in the past year, and I wonder about it even in terms of the outbreak picture that you showed for that shelter. I'm not familiar with that shelter. But I would say that the majority, the vast majority even, of the time that I spend helping shelters manage outbreaks, in quotes, the vast majority of my time is spent showing them that, in fact, they never had an outbreak in the first place.
That it was always just there.
And no, that it's not ringworm even, that there is this fear about ringworm out there, and there's such a huge amount of misunderstanding about how the diagnostic tools work that most of the shelters that contact us because they think they're having a ringworm outbreak, in fact, are not having a ringworm outbreak. And that's really heartbreaking. And I would put that up there with, even most of the shelters that contact us because they either have already depopulated or are about to depopulate. The majority of them, when we ask them, when we have them send us the cultures that they ID'd as positive or whatever, it's not ringworm. And so there is so much fear out there about ringworm, and that's not to say that ringworm isn't real, but I think that the level and the sort of fever pitch about it has been exaggerated to some extent. And yes, it can do really bad things, and there was one outbreak even in the last couple of years where I understand that, humans were getting disfiguring infections and terrible things happened. But I suspect that, yes, there is a responsible way, and especially, this is what I was saying earlier on in response to Kate reading the email, that I think especially once we start a truly effective treatment, the cats have a very, very low infectious potential.
Right.
And so that's where... that's where I wonder too, when could we just call it? On the other hand, what I think I would suggest for you guys is to make sure as a first step that you really do have a really, truly effective treatment protocol.
Right.
Before you start sending them out.
And that's part of my proposal as well.
Yeah, and then the other big thing, again, not a published study, but just some fooling around we did one summer, I think we published it as a poster somewhere I can look, is we had a vet student look into the foster homes where kittens were sent to foster care, and then we found out later that they had ringworm. And we had a student who would go to those homes and do cultures to see how hard was it to get it out of the homes. And it turned out it wasn't that hard to get it out of the homes if the people had confined the cats and if they had been sort of compliant in terms of taking the cat out of their house and having it treated. The homes that were really, really difficult were the ones where they weren't using effective treatments and they weren't confining the animals and they weren't being compliant about the cleaning strategies.
Okay, I'm just going to continue because we don't have very more time left here, but so this is a case study that I just kind of was using as a reason why we decided to maybe see what was going on with the adoptability question. So this is one of 26 Persians that came into the Oregon Humane Society through our investigations department over the last couple months, all from an overwhelmed breeder. In quotes, I guess. She had gotten rid of some of her males already, but we took in 9 of them and then 17 females. We had 10 kittens, 15 of the cats were woods lamp positive, and we also had 2 bonus domestic short-haired kittens that came along with everybody else. The kittens all had ringworm. 5 adults were woods lamp positive or had obvious skin lesions. And we got a P1 culture out of the rest of them, so we followed the Wisconsin protocol of dip and tip. They also had other problems, including upper respiratory, tritric, and ocular disease. We dipped all of the cats on intake, and then we quarantined the positive cats and kittens. We started our oral treatment protocol and the Lyme dips, and we shaved the mats off of the ones that had them. And then we fast-tracked the adult cats that were wood lamp negative. So we explained that they had all been exposed to ringworm, and we gave ringworm pamphlets and ringworm information out to the people who came in to adopt them. And that was great, but our quarantine room was still full. So we managed to adopt out all the wood lamp negative adults right away, and people really liked them. So these are just a couple pictures from the investigations files. We've got the sort of weepy eyes, and then we've got the wood lamp positive hair, and then we've got this poor cat that had a desmetacial and some pretty nasty upper respiratory. Of course, he didn't have much of a nose to start out with. And so the people that came in to adopt the adult Persians told us that they really wanted more Persian cats and that they would be happy to take them even though they had active ringworm, and they could get themselves infected and their kids infected and their friends infected. So we collected their email addresses and we talked about it for a while, and we decided that we would make them available for adoption. They weren't allowed to go and play with the other animals after they came to visit with the Persian kittens. We sent them home with 3 weeks fluconazole and a ketoconazole shampoo because we didn't think that the Lyme dip would get very good compliance. And then we advised them to contact their family veterinarian immediately. So we don't know if they continued on that particular treatment protocol, but we encouraged them to make sure that the cats were being treated. So this is little Dora here, who at the age of 4 months and 1 week got adopted as a cat that had active ringworm. And there she is again. So the nice thing about that was it really emptied out our quarantine room. We were surprised at how many people really, really wanted that Persian kitten. It didn't matter what condition it came in. We did have 2 cats that stayed behind. Both of them didn't really have the personalities the others had. One of them is now culture negative. And then 1 runty kitten that is almost ready for neuter, and then 3 wingling kittens that are in foster that belonged actually to one of those 2 cats. And then we had 2 cats that were returned later for diarrhea. None of them were returned for ringworm concerns. They also were returned with full bottles of ranitazole, so that might explain that one. And then I'm actually planning to follow up with these guys and email them again and see how many people ended up getting ringworm. So this is our proposed protocol. I've got 3 slides about this. So our proposal is to screen with a wood lamp upon intake, and then if we find a suspicious lesion, that we would culture those. The oral medication would be terbinafine at 40 mg per kg once a day. If they're more than 1.5 kilograms, that's a dose for a quarter of a tablet. If they're less than a quarter of a tablet size, then they would get our generic itraconazole until they got to be big enough. And then they would be bathed at 8 ounces per gallon with the lime sulfur, and then once they were lesion negative and they'd been on meds for at least 3 weeks, we would switch to Excel shampoo because we would be moving them to a different room. And then we would culture them weekly once they stopped being wood lamp positive, and it sounds like that would happen right away with the 8 ounce a gallon lime sulfur. With the disinfection, we would be cleaning the cages with 10% bleach daily. Figure out a better way to get the bleach dispenser to have an accurate dispensing of a certain concentration. And then clean the floor with the 10% bleach twice a week, or as often as the cats and the staff members could stand it.
So the studies that show that 1 to 10 bleach will kill ringworm spores are in a test tube, but we don't generally recommend that anybody actually uses 1 to 10 bleach to clean.
Oh, okay.
Yeah, as you said, I mean, the fumes are horrific. It's not good for the people. It's not good for the animals either. And so 1 to 10 bleach is kind of like a rescue. You know, if you know that you got a ringworm-infected cat in and you didn't realize it and you got it all over everything and you want to use 1 to 10 bleach, you could try that, but you're probably not going to achieve a 10-minute contact time like what you would achieve in a test tube. So in general, we recommend, we always joke about it and call it elbow grease. It's really much more about cleaning up, so making sure that things are really kept clean and all hair is removed and dirt and debris and everything else is removed than it is about disinfecting your way out of ringworm. So in general, we don't actually recommend using a 1 to 10 bleach as a daily cleaning.
Do you have a concentration that you like?
So we, if we're using bleach, we use 1 to 32, but we would only use it after using another detergent. But we've actually gone, I don't have the information yet on it, but we've made a switch to spot cleaning in our treatment center so that we're
excellent.
disturbing the cats less. And then on dip days, we clean very carefully, and we're just in the process of switching over to doing that with the cell. You want to make sure, though, that you don't have a cell and bleach in the same area.
I know that.
But you could use trifectant for that as well.
But again, you don't want to have trifectant and bleach in the same area.
Right. So we actually have taken bleach out of our treatment area and are making a switch to a cell. I can't tell you whether that will make us happy, but far from what we're doing, it seems like it will.
Excellent. Okay. Yeah, well, that's also...
And bleach doesn't make us happy on a daily basis anyway.
No. And, of course, that's on my list, too. So instead of using the broom, we would have them use a dust mop that has a removable bleachable cover, and then they would Swiffer after that, and then hopefully we'll get, at some point, a switch to Excel Cleaner, but these things tend to take time, so it's in the works. So this
Lena,
is
are you gonna did you say they're letting all the kittens out to play on the floor?
Yeah, no.
Well, not
no.
anymore. Yeah.
No, that's actually been stopped already.
Oh, okay.
And as you guys know, I mean, we have a lot of turnover with staff. I mean, not a lot probably compared to some places, but part of this is the uphill battle of keeping everybody aware of what is supposed to happen. So,
yeah.
Dr. DeTar with that.
I mean, I can certainly appreciate the desire when young growing kittens are confined for so long
It's
to
so hard. They're so
Yeah,
sad.
you wanna
give them some out of cage time, and I don't know if there's any thoughts on like, is there a way to get away with that? Is there a way to generate a little out of cage space for kittens to play in order of where they are in treatment?
Well, I mean, that's a tough one. I don't think it's one that we're ready for yet. They do have fairly large cages, so at least there's that.
Yeah, I mean, I think I agree with you. I think it's okay for them to have out-of-cage time, but my goal would be to get them in and get them out.
Absolutely. So this is kind of the study part. So when cats have had 3 weeks of oral meds and they're Woods lump negative, we'd move them to a new clean room, and we would make them available for adoption. So people could come by and visit after they visited everybody else. They'd have a chance to visit with these cats and take them home if they wanted. Until they got adopted or were negative on the cultures, we would continue to culture. We would show, like I said, show them from the back, and then the owner would go home with treatment and cleaning information, 1 to 2 weeks of oral medication, 1 to 2 weeks of shampoo, a coupon for follow-up cultures weekly. So they could come in and see me, and I would culture their cat and like, send them out the door, and then a consent to be contacted for a follow-up survey. These are the questions that I would be asking on the survey. There's 10 of them, so bear with me here. What was it about this cat that led you to adopt him in spite of the ringworm? How much did you know about ringworm before adopting your cat? Treatment of the cat was easy, difficult. Oregon Humane Society gave me good or bad information about treating ringworm and disinfecting my home. OHS gave me good or bad treatment and follow-up services for my cat's infection. I've contacted my family vet before adopting the cat, and then I have been working with my family vet since adopting the cat. Did any humans in your household contract ringworm? Were any of these humans under 16? And did any animals in your household contract ringworm? Were any of these animals under 6 months? And would you recommend adopting a cat with ringworm? Somebody else in a similar situation. So those are the 10 questions. Thanks for sitting through all those. And these are the data that I might. Sorry, go ahead.
Sorry, one question I might suggest that you just change a little bit is after 3 weeks of treatment, it's almost like you might want to say, would you recommend adopting a cat under treatment?
Okay.
Because it's a little different than just adopting a cat with ringworm. You know what I mean?
That's true. I will change that.
Another question I have is,
Yes.
were you going to gather demographic information about, are there people under 16 in the household? Are there pets under 6 months in the household, so that you'll know the difference?
Yeah, so that is information we ask them when they adopt the cat.
Okay.
And so I was hoping to be able to get that information from the adoption sort of information that we collect. So, and of course, they would be informed that kids are more likely to get the ringworm from the cat, so when they were, getting counseled for adoption as well. So it wouldn't be a surprise to them. So this is the data that I'm interested in gathering. The time to cure, when we're here in the shelter to see if our new protocol is working better, which it sounds like it should. Time to cure in the home, if I can manage to track that. I know that there's going to be some of this information lost to follow up. The length of stay in the shelter for our ringworm cats before and after implementing the new protocol. Some epidemiology stuff, so how much infection did we spread by adopting out cats that were still under treatment? And then marketing information, so how do we sell these cats to people? Why did they adopt them? What can we do to enhance that to try to get more people to adopt them? And then how well are we doing fostering a veterinary patient-client relationship with the community vets?
Knowing how good Oregon Humane is at marketing, I really look forward to seeing your ringworm cat adoption promotion campaign.
I will send it by as soon as I figure out what works.
I hope it's going to have something to do with the gift that keeps on giving.
That might work. Yeah. So suggestions. I've got some
ringworms.
Again. Say what?
You could do a spin on the 12 Days of Christmas with 5 golden ringworms.
One of the shelters that I know does adopt out some of these cats have adopt a fun guy campaign. So that one's pretty cool. Can't steal that.
You know that joke, right?
The fun guy?
Yeah.
I think I've heard it. If you want to tell it, go ahead.
It's, Mushroom goes to a party and they say, "Hey, you weren't invited," and he says, "Oh, come on, I'm a fun guy."
Nice. So this slide I put up here to remind ourselves that, of course, cats aren't the only ones that can get ringworm. We got puppies and cows and guinea pigs, and that's a chinchilla on the end there. So the suggestions I was hoping to get some feedback on was, should I include data from the Persians in this study? And would their breed-related adoptability skew the results I have?
It's interesting to me that you're seeing such breed-related adoptability with Persians. I'm curious what everybody else has to say. I mean, we've never had Persian kittens in the shelter here, but Persian adults I don't think necessarily get adopted. I mean, maybe a little better than other cats, but I don't think Persian adults are as desirable.
They fly out here. I don't know what it is about Oregon.
Yeah, ringworm or not, they get adopted quickly here.
That's interesting. I mean, so it might be interesting, I think, once you get your data to try including and excluding and see how that affects your data.
Cool. Should I be asking about compliance, or would they be less likely to fill out the survey if they feel guilty for not giving them meds? And then should I be trying to figure out where this cat came from in the community, try to plot sort of demographic information that way? I guess it's not really demographic, epidemiological information that way. Any other questions that you think I should have on the survey? And then where would I be looking to publish this type of a study? Would it be, Vet Derm? Would it be, epidemiology magazine? Like, what would you suggest I aim for?
It seems like there's lots of places you could. I mean, Vet Derm has been really open to papers on ringworm. I'm sure Karen would be happy to talk to you about it too once, either before or after you got things underway. There's nothing she likes more than a good ringworm study.
Awesome.
You might, I don't know what the prestige is of Vet Derm compared to the Journal of Feline Medicine and Surgery. But the Journal of Feline Medicine and Surgery is available online for free to a lot of people.
Yeah.
So it's probably more read.
And they're very open to stuff from shelters and on ringworm as well.
Yeah, I like that idea.
So there's probably more sort of general cat practitioners who monitor the Journal of Feline Medicine and Surgery or receive it than who monitor and receive veterinary dermatology. So we just have to think about doing a little bit more work if you want.
And that would be nice, especially if we have that VPCR data to show those practitioners that we're interested in working with them.
Yeah.
Yeah. Interesting. Okay, that sounds good. And that's it. That's what I got.
That's great. It's exciting. I'm really excited to hear if you change your protocols, how things will go. I've always kind of wondered what would happen, if you get them sort of over the hump of treatment, if they would just self-cure the rest of the way on their own. If you use a really effective treatment in the first place. It seems pretty clear that if you're not using a effective treatment, that you can get them on a good trajectory and then you stop and then it just comes back. Or it lingers, one or the other, but I've always kind of wondered if you have a real effective treatment, like are they just on that trajectory and they'll just clear?
I like with the 3 weeks of Sporanox.
Yeah.
Yeah.
Well, and the topical lime sulfur seems to be really important. We have tried treating some cats with just the Sporanox, and that's not great either. That you get real prolonged times to cure that way too, and lots of environmental contamination.
You tried treating them with just the lime sulfur?
Yes, same deal.
Okay, excellent. Well, thank you so much, Dr. Newberry, for all your help. I really appreciate it.
No problem. It's really exciting.
Yeah, and Dr. Hurley.
Congratulations on your cunning dispatching of your rounds duty in admirable fashion and getting a free consultation with Dr. Newberg.
I know.
Isn't that great? Thank you.
Sharon should be very proud, and I will tell her that.
Okay, thanks.
And also, thank you for bringing these interesting questions to the group. Really great job.
Absolutely. Yeah. Thank you very much.
Bye-bye.
All right, we'll see you in a couple weeks.
Hi, everyone. See you in a couple weeks. I believe it will be fun with Parvo. Yay!
Hey!